Hello, everybody. It's Carlos from the Family Care Center. We have with us Duane. He's our Director of Veteran Services here at the Family Care Center. Say hi, Duane.
Hello.
And Duane, if you just tell us a little bit about yourself and a little bit more what you do.
Sure. As Carlos said, my name is Duane. I'm the Director of Veteran Services. We've been working here really since the beginning of Family Care Center. I retired from the Army after 22 years in 2014, 5 combat and operational deployments. After retirement, I became a clinical mental health counselor, did a lot of work with our local Veterans Court, and really now I'm focusing on managing the Veterans Program. So we manage the VA referrals through the Department of Veterans Affairs, our Veteran Court program. I also manage a grant-funded program that helps us or allows us to work with veterans that may have some obstacles to care. Maybe they're not eligible for the VA or it takes them a little bit of time. So I manage pretty much most of the services here that have to do with the veterans.
And what is the name of that veteran grant?
So the program, the nonprofit, it's professionally affiliated with the Family Care Center as the Colorado Veterans Health and Wellness Agency.
Okay, awesome. That's so perfect. So all your patients are veterans. What's the overarching theme for your veteran population with this COVID-19 crisis?
You know, a couple of different things. I've had some veterans say that it's not affecting them very much, that they're pretty much just staying at home anyway, and they're kind of cool with that, right? So for some veterans, it's like, okay, maybe some people will understand a little bit how it feels, how they feel personally. But I have had some veterans that have had some increased anxiety, some increased depression when it comes to this. Mainly because some of them have said that it makes them feel like the bad parts of deployment without the good parts of deployment, like I'm stuck in one place and I can't go anywhere and there's nothing to do. And
like Groundhog Day.
Right, Groundhog Day, right? Yeah. But without the action, and not necessarily even the combat stuff, but without a mission to accomplish. And so I have had some veterans that have been experiencing that.
So do you find that your veterans are, because isolation seems to be a big thing with our veterans, especially those with PTSD. Are they more isolated? Is it affecting those guys worse?
Yeah, yes. And this is, I do a lot in the community when it comes to suicide prevention. And Thomas Joyner has, it's called the interpersonal theory for suicide. And it's really 3 different factors. And it's a sense of isolation, a sense of burdensomeness, and then acquired ability to enact lethal means. All 3 of those things really have to be in place for somebody to get to a place of a suicidal crisis. Well, this is increasing that sense of isolation, and in some ways increasing a sense of burdensomeness. And so it can enhance some of that. I mean, it's one thing sort of think that you're isolated, and another thing to actually be isolated where, maybe people aren't reaching out. This is one of the things that we're starting to see with some of these online meetings. We're only talking to people that we know. We're not having a random interaction with somebody that we don't know. Say we go to a coffee shop and bump into a buddy at the coffee shop or something, have a conversation. We're not having those kind of random interactions. And so it has to be very deliberate for us to reach out or for other people to reach out. So the isolation piece is making a difference for a lot of veterans.
Wow. Yeah, so put on your first sergeant hat for me, Duane. What do we tell these veterans out there to do at this time?
Well, for a lot of us, we've been through the suck, right? We've been through and gotten through difficult times. And a lot of times, maybe, especially after we leave the military, we forget that we had the ability to do that. I mean, right now, those things that would normally be pathological, like obsessive hand washing, is a symptom of OCD, but right now it's just good public health. So it's one of those things that, yes, everyone has a heightened level of anxiety. Everyone has a sense of isolation. Everyone is having this increased frustration. And so it's recognize that there's nothing wrong with you. It's what's happening right now. And so another thing is really to try to find a sense of meaning, something to do, maybe some purpose, in the midst of suffering, because that's what this is a lot of people are suffering right now,
Right.
and try to figure out something to do, whether it's, pick up a new hobby, go to YouTube and learn how to play guitar, or, again, find different ways to reach out to people and connect with people in some way. And knowing that this isn't going to last forever, that there is going to be a time where this is going to be over, and just hunker down and grit our teeth, and sooner or later the suck will end.
Guys tell my those all the time that we can do anything for 30 days in the military, right?
Right.
Let's send you to school, stand on one leg. Okay, first sergeant, not Roger, stand on one leg. And so, yeah, it's great advice. If people want to know more, learn more, where should they go?
And I'd actually, I shared some links with you, to maybe attach to this in a poster. There's a lot of different resources to help people understand what's going on. Obviously, you can go to our website, fccsprings.com. We have a lot of resources there on our veterans page. There's an organization called Psych Hub that they have some short videos, 3 to 5 minute videos that really kind of explain what some of this stuff. They do have some COVID-19 specific videos, but then just videos talking about, suicidal ideation, and talking about insomnia, and talking about depression. So I would say that our website, and then psychhub.org would also be a good one.
Okay. There's also a pretty good blog. What's that called? Mental health something.
Oh, the veteranmentalhealth.com. Yeah, the Headspace and Timing blog.
Headspace and Timing. That's a very good blog.
You can find that out there as well.
Yeah. All right. Well, hey, Duane, we appreciate your time. Is there anything else you'd like to talk about, say, mention? Here's your time.
I think one of the things is this is an opportunity for veterans to stand up and help other people, right? We heard this after 9/11. A lot of Vietnam veterans felt like they had a sense of purpose after 9/11 because they were helping people manage this. And so maybe this is a way for us veterans to help our community manage some of the things that they're not used to, right? It's a way for us to stand up and say, yeah, this sucks. I got through the suck. You can get through the suck too. So reach out to somebody, give them not a literal helping hand, but a virtual helping hand, and and stay well, and we'll get through this.
Awesome. Duane, thank you so much for your time. I appreciate it today. We will make sure this is posted on our YouTube page for everybody to see, and we will just talk to you later.
Absolutely.
Great day, Duane.